name is Otávio Pontes. I am a neurologist and a professor of neurology at Ribeirão Preto Medical School, University of São Paulo, Brazil. I'm also editor-in-chief of the World Stroke Academy. It is my great pleasure to be with you today to discuss a very important paper that was selected as the paper of the month of the World Stroke Academy. The paper is called Strategies to Advance Stroke Care in Women, an international conversation. As you know, March is the Women's International Month, Women's Health Month. And it's time to emphasize that women have unique healthcare needs and also a higher risk of certain health conditions as stroke. And it's my great pleasure to have with me today three brilliant and young stroke neurologists that are moving forward this agenda all over the world and also discussing and authors of these important papers. One of them is Ana de Souza. One is a stroke neurologist and member of the board of directors of the World Stroke Organization. She also is a clinical trialist and works in the Genesis WSO committee. I also have the pleasure to have with me Karen Orjuela. Karen is a vascular neurologist of the University of Chicago. And Julieta Rosales, a stroke neurologist and stroke unit coordinator at Clínica Sagrada Família, and also future stroke leader of the cohort 3. Ladies, it's a great pleasure to have with you and me today. Thank you so much for joining. And I will start asking first Karen, Karen, your article emphasized that women often experience worse stroke outcomes despite lower incidence rates compared to men. Could you talk a little bit about the most critical life stage risk factors for women and how these unique vulnerabilities are currently being addressed or overlooked in the clinical practice?
Thank you, Octavio. So yes, I think that we have to see the whole lifespan of sort of like a women expectancy. There are times where the incidence of a stroke is greater compared to men. For example, in the younger stages, a stroke in the young is higher prevalent, it has a higher prevalence in women. And that's a little bit overlooked in sort of like a different analysis. And why is that? We still don't know. So important aspects of our life as women are overlooked, like pregnancy-related complications, for example, hypertension disorders during pregnancy, and complications after delivery as well, that mark a greater risk of stroke. And perhaps we should do a better job of identifying blood pressure changes, diabetes, weight management, etc., after reproductive different conditions as well. So that's one episode. Then women will live longer than men. And our life expectancy, even though we have perhaps different incidency of a stroke, we are taking over sort of like years. So we have other sort of like outcomes, like cognitive outcomes, right? There is a heavier responsibility, social responsibility of women taking care of households as well after a certain age. So there is a lot of like component of, yes, individual outcomes that we are very good at measuring, but also social and community outcomes that women actually have greater impact and greater sort of like consequences of sort of vascular diseases that women carry during their life expectancy as well.
Yeah. Yes. Thank you so much, Karen. Ana Claudia, one of the major challenges that you guys have discussed in the underrepresentation is the underrepresentation of women in clinical stroke trials, right? What do you see as the most effective strategy to ensure that future research not only include more women, but also analyze these sex disaggregates data and inform about how can we tailor the stroke care to address women needs?
Yeah, so thank you so much, Octavio, and thank you for giving us this space to talk about this so relevant point, that is how we can include more women and the relevance of this topic. I think we can discuss it in different levels. For example, we can see why women are not engaging in trials. So if we can think about it culturally, women are the ones who take care of the family, of the child, of the children. And the question is, who is going to take care of the woman when she has a stroke? So this is very sensitive. So a lot of strategies we can discuss is when you are, for example, designing a protocol, you must train your team how to address the sensitive points. For example, sometimes the woman has the child, so maybe you can give the opportunity to have a room inside of the research building and someone who will take care of the children, you know, when the patient is going to be inside of the trial and having the interview. So it's something that maybe we can stop and see how we can incorporate those women and listen to their needs. We know that maybe sometimes women, they have specifically fears of entering in a trial. For example, if I am going to have a child, what the expectations, they have this fear, and sometimes people in the family, because of cultural thing, they just discourage this woman to participate into the trial. So the staff that will include the participant should have this training, how to address, and mainly to have more women that will approach this woman, you know, because they understand better those needs. So it will vary because of the cultural, the religion, the regions, but we should tailor it specifically to women. And I just wanted to add one more point, is how we can include more women in the leadership of those trials. You know, unfortunately, data on that shows that only 20% of the women are PIs, you know, principal investigators of the trials. So this is another thing that should raise awareness. And another important topic is to encourage the sex disaggregated analysis is the policies inside of the journals. You know, the journals, they should, like, we have some journals that already are disclosing, did you analyze that? Why not? Please include it. So the policies that we must build to encourage more inclusion of women and more analysis, because we are biologically completely different, and the trials, they must be designed to incorporate this. So this briefly
Thank you so much.
summarizing it. Yeah.
Thank you so much. Yeah, very important message. Now, Julieta, the paper calls for international collaboration and policy reforms to reduce sex and gender disparity in stroke. Can you share some examples of some successful global or regional initiatives, and what more can be done to scale up these efforts, especially in low and middle income countries?
Thank you, Fabio, for highlighting our work. And the members of this interview actually are members of this collaborative initiative. For example, Karen is part of Go for Red, is part of American Heart Organization, and there is a subcommittee of gender disparity in World Stroke Organization too. Neuroradiologists in the world have a very, very active group called WIN, Women in Neuroradiology. I'm part of this team too, and they help another women to perform a fellowship under good conditions. And INARATAC is a Latin American group of stroke neurologists created a subcommittee of gender disparity called LUDNI, and Ana Claudia actually is our chief, I could say. But on the other hand, as we are member of World Stroke Organization and actually Future Stroke Leaders, we want to create data of lower and middle income countries. So we are submitting a project called Bridge, in which we will assess the access and the adherence to evidence-based acute care measures in these countries to test if we suffer higher gender disparities in comparison to high-income countries. So these are the collaborative organization, and the next step is to have local data about gender disparity, and the next step is to create an implementation plan.
Okay, guys. I really want to say that, as a man, I'm very proud of all your work, and this is a very strong and positive message for our society. We have to emphasize that, these compelling arguments that you have laid out make it very clear for us that there are gender disparities in stroke care, and this is not just an issue of scientific oversight, but it's more of a matter of health equity and justice, right? I think you made a very clear message that the time for action is now, and we need to address the stroke prevention, treatment, and research in a very inclusive way, and considering all these challenges faced by women across different life stages and socioeconomic backgrounds. I just want to thank you so much for your work to move forward this agenda. And as the World Stroke Academy and also World Stroke Organization, we are so proud of your work, and you can count on us to move forward this inclusive agenda for women. Thank you so much for your help.
Thank you, Otavio.
Thank you, Dario.
Thank you, Octavio.